Ahead for us this half hour, concerning headlines that the COVID-19 vaccine isn't very effective at preventing infection among younger kids. We're going to go through the results of a new study and talk with one of Western New York's top pediatricians. Plus, a couple of big event venues in Western New York dropping their requirements for vaccinations and masks. We'll go over those changes. And you've heard of drug sniffing dogs, but what about COVID sniffing dogs? You won't want to miss a special report that we have tonight on the role that canines can play as we prepare to live with the coronavirus. Good evening to you. We're going to start tonight with some help for parents who are trying to make sense of a new study that shows how the COVID vaccine for kids age 5 to 11 was not very effective at preventing infection with Omicron. Now, this hasn't been peer reviewed yet, but it comes from data collected right here in New York State. In a moment, an expert will weigh in and help us understand this new research, but first, the findings. Clinical trials done before Omicron showed that the Pfizer vaccine was 90.7% effective at preventing COVID-19 in kids age 5 to 11. Well, the New York State Health Department then looked at kids in that same age group from December 13th to January 31st, right during the Omicron wave. The researchers found the vaccine effectiveness dropped to just 12%. That's the headline that's showing up everywhere today, and it is significant. Just like with adults, the vaccine is not as effective at preventing transmission with the Omicron variant. But it seems really ineffective with younger kids. Why is that? A couple of important points to show you here. During that Omicron wave, the vaccine was still 48% effective at preventing hospitalization in kids 5 to 11. So in other words, unvaccinated kids were almost twice as likely to be hospitalized. And research out today from the CDC showed something similar. So it's still pretty good there. But when you compare age groups, you can see dosage may be an issue. Children in the 5 to 11 age group get only 10 micrograms of the vaccine. Kids 12 to 17, on the other hand, get the full 30 micrograms of the vaccine, just like adults. Well, this study shows a big difference between kids in those age groups. If you look at 11-year-olds and 12-year-olds, again, this is the last week of January, the vaccine was only 11% effective against infection for kids age 11. Remember, they got the small dose. If you go up just a year to 12-year-olds, it was 67% effective. They got the full dose. So this study recommends further research looking at the dosage levels. There is a lot to unpack here, and we're going to be asking questions that parents are asking to Dr. Steve Turkovich, who joins us live now. He is Chief Medical Officer at Oishei Children's Hospital. Dr. Turkovich, it's great to see you. No doubt this is not the result that you want to see. Obviously, the most important objective with any vaccine is to prevent what you call severe disease, right? Hospitalization or death. But kids rarely get hospitalized to begin with, and so there was a lot of hope that this vaccine was going to be good at preventing infection, and it was really good in the trials before Omicron. How much of a setback is this?
Yeah, I'm not sure I would call it a setback. I think the most important piece to come from both of these studies, both the New York State study and the CDC study, is that it is highly effective in helping to prevent severe illness. So looking at children that need ER visits, urgent care visits, or hospitalizations, it's very, very effective. The other thing is that there's been studies that have come out over the last couple weeks that have showed that vaccinated children are significantly less likely to develop the multisystem inflammatory syndrome that children get. So it looks like, although this can't really prevent the disease and testing positive as much as we would have liked, it does help prevent those things that are much more severe that could have long-term side effects on children.
For a parent who is watching right now, who does a cost-benefit analysis of getting their child vaccinated, what would you say to them on why they should choose to go ahead and get those shots if the efficacy is so low with Omicron in terms of at least being able to get the infection? Because for a lot of people, they're looking at this like, I want to get my child vaccinated so they don't get it and then pass it to someone who's more at risk, or I don't want them to get it so that they can stay in school and that sort of thing.
Yeah, those are some very important considerations. And although we would have really liked the vaccine to prevent that transmission, as we've seen with all age groups with Omicron, that transmission is really not decreased because of the vaccines. Now, getting a booster shot certainly will help, and we've seen that in the older kids. And I know the CDC is looking at Pfizer's studying a third shot in younger children now to see if that booster will help protect them. But at the end of the day, the most important thing to do is recognize the risk profile of your family and your friends and do things that will help protect them. So those that are at higher risk, it may be worthy wearing a mask around them, But also the good thing to note right now is that therapeutics are much more widely available than they were in the past. Both oral and IV treatments to treat somebody with COVID, but there's also IV treatments now that we can give to highly vulnerable people with suppressed immune system that will prevent them from getting COVID in addition to the vaccine. So although this is disappointing, I am encouraged because we've got a significant, much more robust toolkit now than we did when the pandemic started that will really help us protect the most vulnerable, which is really where we need to start shifting the focus to.
Yeah, as we try to live with this, right, which we know that we're going to have to over the longer term. You mentioned booster shots, and I want to ask you, because the news was much better in terms of a study that came out about that today, looking at kids aged 12 to 17 who have been eligible to get the booster shots. It seemed like, if I read this correctly and what the CDC put out today, that those kids actually had less of a chance of having some type of severe reaction, which is extremely rare to begin with, but it was even less of a chance than their just normal second dose. So what are we learning about booster shots for the 12 to 17-year-olds?
Yeah, so the immune system is really interesting because the more it's reminded of what it should be fighting, the more it's going to provide those antibodies. So that booster shot reminds the body to say, hey, listen, this is the bad thing. Make sure you have your defenses up and create some antibodies. And that's what it does. The other thing that it does, it creates T cells that are sort of your memory cells that aren't really great with the first line of defense, but they're really good with preventing severe illness. So if you were to become infected, the more of those T cells that you have, they're going to clean up that virus much more quickly in your body and prevent it from ongoing, causing severe symptoms and infection. So the booster shot certainly does help, and I would suspect that if the evidence does show it's effective in the 5 to 11-year-olds, that we would see that approved sometime in the future.
Finally, Dr. Turkovich, a lot of people preparing for tomorrow when the mask mandate goes away for our schools, although certain districts can certainly determine to leave it in effect. Your reaction to that and just kind of where we are right now. I mean, cases are very, very low. Our hospitals aren't as stressed as they were before.
Yeah, the way I look at it is that masks are a tool. And in the beginning of the pandemic, we didn't have many tools. We had masking, social distancing, and really shutdowns and closures. Now we've got oral and IV therapeutics. We've got decreasing viral density in the community as evidenced by decreased hospitalizations and case numbers. So right now, I think it's very safe to move to more of an endemic phase and think about how do we really protect those that are most vulnerable. And that is going to allow us to relax some of these other risk reduction strategies like social distancing and masking. It doesn't mean that we shouldn't be vigilant because there could be future variants out there and those things may need to come back. But right now, I think we're in a position where it's safe enough to reduce the masking and the social distancing.
Dr. Stephen Turkovich is Chief Medical Officer at Oishei Children's Hospital. We're so glad you had time to talk with us and help us understand this news coming out today. Thank you.
My pleasure. Thank you.